It's so ironic that we talk about that because today's topic is balancing work and family.
Stay true to your family and always be there for them.
The role my father gave me on a personal level was not to be like him. I really never seen him working. The other people outside that I would watch.
The model my mom gave me to support your family and just to work to the best of your ability. Mom was basically my father. I mean, I knew my dad worked, but he wasn't there. My mom was basically there. She worked, came home, cooked, cleaned, took care of me. That was our family, just me and her. So I just brought that trade to my kids.
My mother was my father. I was the man of the house anyway. I'm the oldest for everybody else.
Since you were the older, you were the senior, you had to take precedence. You had to be the captain of the ship.
You had to handle the whole weight.
You had to be the chief in the truck.
Yeah. Yes, sir.
That's all right. Yeah.
One thing I would do different, be there in my life, my kid life more, because before I wasn't being there because, like I say, I was working a lot before, and they understand that I have to work to take care of them because I was the only one working in the house. I like to be there more for them, be a better parents. I would love to be a role model for them so that someone they can look up to about anything they need in their life or to talk about anything.
More of an open communication with my kids, being able to relate to their situations with an open mind.
I like that one where he said communication. Just being there, being there for my children, just letting them know that we are one, and that communication is a very, very important. So that's one of my biggest goals. We often just sit down and just talk. If we don't do nothing but at the dinner table, playing around. So I would also go along with communication.
I wish I could have all my kids live with me.
I had to concentrate more on my education than on sports. I got just pushed through my grades because I was a good athlete. So I would have been probably, graduated college by now if I wouldn't have been playing sports.
Three pleasures I get from my work are
Your goals, having a sense of humor, and just having a successful day. And that's just by someone smiling and you learning from them.
And then I got satisfaction I get from helping somebody out, and then the satisfaction I got from helping them out helps them to put a little bit more money in my pocket so I can spend it on my kids. As far as the checks goes, which are able to, for me to get an income, for me to help my kids out. So it's all like a circle.
three pleasures I get from my work are.
First of all is that paycheck, that income. And feeling good about myself. I guess keeping myself busy.
Being respected.
Being respected. Feeling love, being respected.
Put down the time we spend together with my present family.
Okay.
Second one is when my biological kids get to come home. And it's always, it's a good thing. We share like it's a big family.
New Haven Family Alliance, man, been a really quilt over me, man. It kept me warm in my bad times, man.
Going into the program in the beginning, I felt a little bit uncomfortable. Didn't think that I was defeated for being here, that, it was injustice for me to put me in this program. But coming down the line, the reality is that I've learned a lot from the program. Hearing from other fellows that have come in, that have been into deeper situation and have come, out of the situation, succeeded in life. The program also helped me understand a lot of things that I couldn't understand as a father.
When I first came here, I would say, I was court ordered, so I was kind of like, I really don't want to do this. So, but as we went on, like second week, third week, I realized how helpful this is, and how much I was left in the dark before about my rights. And difference I noticed was how I would grade myself now than I would back then about making choices. It'll be a lot higher now because I'm really thinking about it.
I said number one. It feels like, to me, he's graduated from Male Involvement
Network since about 1999. It was then the Fatherhood Project of New Haven, or the Fatherhood Program of New Haven. We became involved in looking at a different model that would serve men more broadly across a variety of needs in front of non-custodial low-income fathers and indeed fathers in general, is how do you manage life in a responsible way in an economy that is worsening by the day? How do you inspire people to take charge of their lives and be and to contribute to their community if the very means of production are disappearing? How do you indeed help men recover when they have made a mistake, paid their dues, returned home, and want to be a part of a vibrant and developing community? And those are the challenges that we try to address in this program, albeit that they're more difficult to do these days than it was when we started.
Well, I mean, we started down this path over 10 years ago as a result of a staff member coming back from a conference in Washington where she met some of the pioneers in the fatherhood movement. And she said to me at the time that one of her takeaways was that if an agency considered itself doing family work with low-income families and that they hadn't engaged the non-custodial father, then they were not doing the full breadth of the work, and that they were colluding with the myth that low-income, non-custodial fathers of color were uninterested, disengaged from their children. So we did our due diligence and found that that was, in fact, not the case, that there were many fathers who were engaged with their children in the best ways that they could be. And so we committed to trying to develop pathways for these dads to engage in healthy ways with their families. And we were very fortunate at that time to have other folk in our community like Amos Smith, Ken Harris, and Derek, Dr. Gordon, who had an equal interest and brought a tremendous amount of experience and skill to our effort to build a system that would support father engagement. And so we've been at that work for the last decade. We truly believe that any strategy to strengthen families has to include the support and engagement of the fathers of children.
I remember when the guys in New Haven were meeting at Hattie's restaurant, and I knew some of the fathers when they were actually 10 or 14, and I knew something of the trauma and trials they'd been through. The effort, we call it changing the social expectations of fathers, has focused on men as fathers. And I've been close enough to see the change. Partly I've been close enough because some amazing bond of trust forms between the fathers in the program and the staff who help them.
From Yale New Haven Hospital's outpatient services area. Help them to develop a program that's going to keep them out of the hospital and actually help them to understand some of the issues that they're dealing with, which we found to be issues related to diabetes, hypertension, and issues related to some cancers as well. So what we have done is we've spoken to them, we've tried to get an idea of where they are at this point in their lives and help them to develop a program and find a medical home as well that would help them along the way so that they would have a provider that they could count on and they could trust.
Started running a cancer program at the Hospital of St. Rayfield. It's called Project Brotherhood. Just speak with the men about their health, try to get them in for physicals, and also since I work out of the cancer center, I tend to talk about a lot of different cancers, but we also ask the men what they may be going through. Because I do a lot of outreach, I tend to meet a lot of them, and they recognize you and you have a sense of bonding with them.
When I attend the meetings, I hear about results, how many men got employed and how many people they assisted at court. And I can tell that they're really connecting to the program. They really feel that this is one program that's really helping them.
Working with pregnant women in my clinic is that when I see a pregnant woman, I know that she's not there on her own. Male involvement is an empowerment to men. It is a resource that other men can get together and talk about what they are dealing with on a day-to-day basis. Male involvement has been an intricate part of my family's becoming self-sufficient. Fathers are able to get employment. They're able to have mentors and role models that have been in the same situations that they have been in. Men that have had child support issues have been able to talk with representatives from the child support services to get that under control, where they can begin to have control again in their families and feel that they can be the fathers that they're supposed to be. So what I see male involvement, and what I'm hoping is that there will be a male involvement program in every city in America.